So Dr. Rugge and I are going to tag team it up here today, and I really would like to say what an honor and privilege it is to be here today, invited to be here to speak with my colleague, Dr. Rugge, about something that is important to all of us, and that being health care. I also want to recognize Ed Bartholomew and the EDC for asking that health care be the spotlight of your annual luncheon. When John and I got together to try to say, well, okay, well, how do we talk about healthcare for 20 minutes and the economic impact of it? We really struggled with that because either one of us could probably talk for about 8 hours straight and not cover everything that we would want to. So what we thought we would do is I'm going to speak first, and because there's such a diversity in the audience, and some of you know a whole lot about healthcare, and maybe some of you don't know much about healthcare at all, I'm going to sort of set the stage in terms of why healthcare is important to our economy, and then talk a little bit about Hudson Headwaters and Glens Falls Hospital and some of the local collaboration that we have done. However, thinking about the future of healthcare, we really need to expand beyond our region. And then Dr. Rugge is going to take it from there and speak about some of the collaboration that we're doing regionally, both locally and regionally, together and with other partners. So, oops, there we go. So why does it matter? Why does healthcare economics matter? Well, right now, the current economic problems in the country can really be attributed to many of the economic problems that we're having with healthcare. I've got a little time bomb there, and I speak to two things: spiraling cost, spiraling upward, plus equally important as the cost is the inconsistencies that we see across the delivery system with not only access, but also with the quality of care that people receive. So between those two phenomena, we are really in the middle, getting ready to have a ticking time bomb potentially explode for our nation. Just a couple quick facts, like sort of, did you know that healthcare accounts for 1/6 of the entire economy of the United States? When we look at the gross GDP, the gross domestic product, just shy of 18% is spent on health care. And that health care premiums, what you and I spend on health care premiums as consumers of health care, but also as employers for your employees, have skyrocketed. And I put a little diagram up there that depicts from the Kaiser Foundation from the year 2000 to 2010, so 10 years worth of data, that health insurance premiums have skyrocketed up by 113%. At the same time, workers' wages have increased, but it's only increased by 34%. So you can see the disparate difference in how fast the cost of healthcare is growing, yet growing faster than the rest of our economy in wages. Couple charts just to depict that. This is from the American Hospital Association, and it looks at the national healthcare expenditures from 1980 to 2013. If you look at that blue line, the line on top, that is our present rate of healthcare expense. Starting in 1980, over about 200,000, and going all the way up through 2013, which is at 2.7 billion with a B dollars. If we had tracked with inflation in the rest of the economy, we would be tracking right where that yellow line is. So you can see healthcare expense is growing much greater than the rest of the economy. This, again, from the American Hospital Association, shows healthcare as expenditures as a percent of gross domestic product. You can see right there, 17.5% of our total GDP is on healthcare. And lastly, just to show you, if we continue at this pace and do nothing about it, that by 2013, we're going to, you can see, well, maybe you can't because that's a small slide, but right now we're spending just shy of $3 billion in healthcare as a nation. If we continue at this rate without changing healthcare, how we deliver healthcare, how we give more quality for the service, how we increase access, cover more lives, we will be at roughly $5 billion in expenditures by 2023. It is unsustainable. So what does this mean to you guys and gals sitting in the audience? The impact on employers. We're all employers. We all buy health care as ourselves as individuals also. But when you keep having to spend more and more and more money on those health insurance premiums that go up, there's less dollars for you to do other things in your companies, whether that be less research, less innovation, less new technology, less new equipment, less new jobs, so the economy is not vibrant. And the jobs that you have, the people that are working with you, you're not able to give them raises, maybe at the rate that you would want to, so there's fewer jobs, smaller raises. And then as buyers of health care ourselves, there's increased premiums that get passed to employees also. So think about this. Healthcare keeps rising faster than anything else in our economy. And our wages as individuals aren't keeping up with that, but yet premiums that we have to pay are really eating up any kind of raise that we may be getting, so as workers. So, just think about that. This is not a sustainable formula to go forward. And what it all boils down to is really what's at the bottom of that slide. It limits consumer spending. There's less dollars to keep putting into the economy for whatever your business is. So healthcare really does impact all of us. So I want you just to hold that thought for a minute as we weave in Hudson Headwaters and Glens Falls Hospital. So right there are two mission statements that are on the screen. And those of you that work in these two organizations, you can't play this game because you do know your mission statement. But look at those. Our mission is to improve the health of people in our region by providing access to exceptional, affordable, and patient-centered care every day, in every setting. Our mission is to provide the best health care and access to that care for everybody in our communities. Whose is who? Yeah, hard to tell. So Glens Falls is on the top and Hudson Headwaters is on the bottom, and I mean nothing by that, John. I thought, uh-oh. But, just to bring it home to Hudson Headwaters and Glens Falls Hospital, a little bit of background on both of us. You probably know the organizations. I'm not going to read the slide to you, but there are some things in here that are very consistent between organizations. We're both not-for-profit organizations. We both exist to provide care, health care. We are both our safety net for rural upstate New York, where we see differences a little bit, but complementary is primary care, which is really been the big basis of the Hudson Headwaters Health Network, is expanding, consistent with what's happening in our healthcare industry. And hospitals, which are large consumers of healthcare dollars, really the end of the continuum in terms of costs, we're looking at shrinking hospitals and trying to provide services in other domains except for hospitals, keep people, patients, in healthier states of wellness so that they're less apt to need services, which happens in primary care. So that's where we start to complement each other. And the hospital provides a wide array of services as it relates to the acute care phenomenon. So, what's the bottom line before I turn this over to my colleague? The bottom line for us is that both Hudson Headwaters and Glens Falls Hospital exist to provide health care to this community. And we are both in the same community providing health care to the same patients. We are both concerned about access to health care, the cost of health care, the rising cost of health care, the quality of the health care being delivered. We both organizations are challenged with the challenges of redesign, specific to all the things that we've seen as it relates to the Healthcare Reform Acts. And it is imperative, the bottom line, when you take all this, it is imperative that Hudson Headwaters Health Network and the Glens Falls Hospital work together and figure out a way to transform healthcare in our community for our patients that we both serve. For what? To make this community strong so that we can assure going forward that there are adequate systems, not even adequate, that we have world-class healthcare in our community. And we need to do that together to work together to do that instead of working in an adversarial relationship. I am going to briefly mention just a couple collaborations that Glens Falls Hospital and Hudson Headwaters have done over the past 2 years. You can read them, I won't go through all of them, but physician recruitment, we work together on physician recruitment. That is a huge issue for all of us who work in healthcare. We're working together trying to plan some graduate medical education. We've worked to help each other, whether it be with laboratory services or 340B program. And most recently, some of you probably saw in the Chronicle this week that we are facing another challenge in healthcare. Every day there's a new challenge, and this one has to deal with pediatrics. And we're working together with Hudson Headwaters and their pediatric group. Hudson Headwaters is with the hospital and has not turned their back on the community and is sticking with us as we figure out how we are going to continue to provide pediatric coverage in the community. And those are just a few examples of what the relationship brings and how we are both focused always on making sure that we're not doing what is necessarily in the best interest of Glens Falls Hospital or Hudson Headwaters Health Network, but in the best interest of healthcare and patients in this community that we all live in. So with that, there's a whole lot of more global things that are going on that I'm going to step back and let Dr. Rugge speak to.
Does the mic work? Can people hear me? I have to start by saying I find this a little intimidating, not because of the crowd. I see a lot of familiar faces. But the last time I was on a stage with Diane, it was a contest.
Oh,
Along with Chris Duffy, who was going to conduct Sleigh Ride, and Diane won, hands down. So, fortunately, this is not a contest. The healthcare scene. Oops.
One back.
Here we are. As Diana said, there's a lot going on in healthcare and a lot of controversy, starting with what should government do about healthcare, best epitomized by the voter in the last election who said no matter what, he wanted government to keep his hands off his Medicare. Hard to do. The right place for competition. We know there has to be competition to keep everybody on their feet, but in North Creek or in Chestertown, what does it mean to compete when it's so hard to give any services at all? And how do we care for the 17% of people who until very recently had no insurance and yet at the same time keep health care costs under control? And then, of course, there's Obamacare. And there's Democrats and there's Republicans. And there's no end of fighting over what to do next and what works and what doesn't work. But there are a few things that at the policy side and even on the political side, I think everybody has come or is coming to understand. As Diane suggested, one is that healthcare in this nation represents a poor value. Costs in healthcare here in the US run twice that of the next nearest costly nation in the industrialized world. And the results, instead of being superior, as measured by morbidity or mortality, are average or maybe a little less than average. There's a lot we can do better. And with that, there is also an emerging consensus about one thing that is going to happen and that we are working on together, government and providers alike, and that is moving from fee-for-service medicine, where every little thing we do has a bill and a charge and goes in and becomes incredibly complex, to do something else very complex, and that is pay for the value for the outcomes that we achieve. Pay more for better outcomes. And faced with that, there are new realities. On the hospital side, enormous financial pressure, in part due to demand destruction. The two D words for what is happening by way of more community services being available, high technology being available in doctors' offices, and the pressure on patients and payers to avoid anything that's costly, and the most costly thing we do is put people into hospitals. That translates into disappearing margins if they appeared at all in New York State for hospitals, and resulting in consolidations one after the other. We're seeing it to the south with Albany Med looking for affiliations with hospitals in the periphery. And St. Peter's, of course, which joined one organization, which in turn joined another organization, went from Catholic Health East to Trinity, and now a multi-billion-dollar organization representing healthcare in Albany and beyond. To the north, the University of Vermont Health Network has adopted and taken possession of CVPH, the hospital in Plattsburgh, is about to do the same for Alice Hyde Hospital in Malone, and is working with other hospitals in far northern New York. Consolidation is upon us. On the physician side, likewise, enormous pressures. Specialists are finding enormous financial pressure and a compression of fees in a downward way like never seen before. For primary care physicians who have been paid less all along, there is not really the prospect of more money, but there is the reality of more work, more to do, more standards to meet, more documentation to do, more expenses to incur, leading, guess what, to consolidation. Physicians leaving private practice at an ever-increasing rate, so the independents now represent less than half of all the physicians in New York State. We're seeing it locally, as you can imagine, and Hudson Headwaters is very much a part of that. In New York, there has been a very aggressive response on the part of the Cuomo administration with the assistance of the legislature. The Medicaid redesign team in the initial year of the Cuomo administration succeeded in capping Medicaid costs, a trend factor to allow inflation, but no more, regardless of the number of enrollees of recipients in Medicaid, even though that number is increasing, especially with Obamacare. It is succeeding. It's leading to a margin for Medicaid, which is being redistributed to providers. It is doing that in part by moving from government being the payer to contracting for managed care for all with managed care companies, assuming intermediary responsibility for the care and the financing of the care of Medicaid recipients. And perhaps most significantly of all, there is a conscious policy of using what happens in Medicaid as a template and the model for what needs to happen for commercial insurance. This is made manifest by a federal transformation fund, a fund in the amount of $8 billion, with a B, $8 billion that was awarded last year to New York for a 5-year period to transform the care of Medicaid patients across the state. This is to be done in large part by creating networks of safety net providers, networks of those providers upon whom Medicaid recipients depend. They happen to include Glens Falls Hospital and Hudson Headwaters. For them to align themselves into networks of care called PPS, Performing Provider Systems. And those performing provider systems, those PPSs, these are all new words to us, are to be funded through DSRIP, Delivery System Redesign Incentive Payments. So $6.5 billion of the $8 billion are to be paid for transforming the way we give care, not for care as we know it now, but for how it's going to come. Value-based payments, no longer fee-for-service. In this region, in this city, Glens Falls Hospital and Hudson Headwaters have combined understanding. We have a profound interdependence upon one another. Glens Falls Hospital depends upon our referrals. We depend on this hospital to keep care where we're helping to manage that care, where we know the specialists, we know the care being given, so that we can be part of managed care for all, so that we can align the care that our patients are receiving and not waste the dollars and waste the opportunity. For all that, we are natural partners, and as Diane has already suggested, it is indeed a working marriage, and everybody in this room knows what that means. Together, we are two parts of a 4-member organization called the Adirondack Health Institute, which is located across town. and was established in 2011 to be a magnet for funding. We were hoping for grant funding. We were hoping for maybe $500,000 in grant funding to do new programs. That didn't happen. Instead, PPSs happened, and DSRIP happened. And yesterday, AHI, Adirondack Health Institute, received its notice of its share of the Federal Transformation Fund, and that notice is for $186,715,496 committed to this area. And the open question is, what are we going to do with that? For Hudson Headwaters, what it means is we are looking to be the primary care foundation for this Adirondack region. Our southernmost center is in Moreau, Saratoga County. Our northernmost is in sight, in twilight, of the Canadian border in Champlain. We think we're going to fill in some of the distance. For Glens Falls Hospital, is providing comprehensive services, the most comprehensive services that any acute care facility can provide to its population, so that we can keep care here and that we can continue to be the center of healthcare and actually an economic center as well. And that what we know is Adirondack Health Institute and through AHI, the two of us can become what we're already starting to be recognized as, and that is a leading model for the state. There are 25 DSRIP organizations around the state dividing the 16 million Medicaid patient population. And as I attend meetings in Albany, hear again and again about how DSRIP is playing out, and 10-to-1, the program that is mentioned is getting it right, getting a head start, having providers work together and cooperate in new ways is AHI. And what this means is the same old, same old. And that is what is enduring here is in addition to the health care we're providing, in addition to what is most important to us, we indeed have a shared responsibility for the economic vitality and the success of this city, this county, this region. Thank you.